What's up? It's Dr. Taylor Crick, host of the AutoImmune Doc podcast, and just a quick little video today about 5 supplements that I like to use in POTS patients that I've seen success with POTS patients using, and they just happen to be from 5 different companies. So I was just kind of thinking about this because I've been recommending these supplements, quite a lot lately with just things usually come to my office in waves, and so a lot of these have been just top of my mind lately. So I was thinking about what are my top 5 supplements for POTS things and some of the mechanisms behind that. So I'm going to talk a little bit about POTS, dysautonomia, and long COVID, because I'd say that even a few years ago, POTS was pretty almost non-existent. In fact, I remember one of my first patients at this clinic when I sold my other clinic and opened this clinic. She said, I would like to come see you just because you know what POTS is and you have experience working with POTS. She said, I can't find anybody else who even knows what POTS is. And I'll talk about that a little bit too, because the diagnosis for POTS is a clinical diagnosis. So sometimes it's hard to get that diagnosis. Around here in central Illinois, previously you basically had to go up to Mayo to get diagnosed, and now I think there's some POTS centers and things, but there's also just it's a spectrum of dysautonomia. And now long COVID is really changing the game with a lot of POTS presentation, so it's becoming a lot more common and a lot more prevalent. So I'm going to go through the supplements, but then I'm going to talk through the mechanisms. And the point of even my whole podcast and social media channel and things, this is not medical advice. Get your diagnosis from the right person and get your treatment from the right person and things like that. But people are out there searching for answers, and there's a lot of supplements out there. And I'm an expert in supplements and nutraceuticals and their application because I've got a lot of clinical experience working with different cases. So this is just kind of more my opinion, more so than exactly what you should do. You should work with a provider, but also if you're out there trying things, most people, especially in the long COVID era, most people are coming to me with a bag full of 20 supplements and they're still not feeling better. So my hope is that I help guide you towards good supplements. And we also sell these supplements too, so you can certainly purchase them through our website, and you can certainly work with me too if you're looking for further help on some chronic and complex cases. But these are 5 good supplements, and the ingredients behind them and kind of the intention and the purpose and kind of why I'm combining these into maybe a POTS or dysautonomia protocol. So the first thing is just kind of about POTS and dysautonomia. POTS is postural orthostatic tachycardia syndrome. So it's very postural related. In fact, it's diagnosed on what's called a tilt table test, and what they look for is problems when you go from sitting to standing, or from lying to standing, or standing to lying, and changes with your autonomic nervous system. So there's a lot of variations of POTS, but it's changes in blood pressure. So a lot of times blood pressure will drop out and bottom out. I've seen some crazy scary numbers with blood pressure with POTS patients. A lot of times heart rate will go up. That's the T in POTS, tachycardia. So, and I've seen people that their heart rate's in 200 when they're going for a jog or something like that, and they're like, that's not normal. Or 150 while they're trying to eat dinner, or it's 95 at night while they're sleeping and things like that. But it's fluctuations especially. There's a lot of flushing with POTS, which can also be part of like blood pressure drops or syncope or standing up and being like, ugh, I'm gonna pass out. You can get nausea. You can get shortness of breath. You can get just easily fatigued or just like poor exertion or poor endurance. You get orthostatic changes, which is changes in posture, changes in pressure, problems with standing for too long. All these kind of fit the diagnostic picture for POTS, or for somewhere along the lines or the spectrum of dysautonomia. Your autonomic nervous system are things that are typically automatic. Your heart automatically beats, you automatically breathe, you automatically digest and detoxify and things like that. And you can override that and hijack your autonomics, but in POTS, your autonomics get hijacked. But this is the balance, autonomics, between sympathetic, which is fight or flight, and parasympathetic, which is rest and digest and relax. And so in POTS, there's typically the presentation is sympathetic dominance. A lot of adrenaline flushes, a lot of what people will call adrenaline dumps, and they get into what's called sympathetic dominance, and that affects their vagus nerve, that affects their digestion, that affects just their cortisol, that affects a little bit of everything, but it's sympathetic dominance. There is often an autoimmune component. Now, this is really hard to confirm, but in the literature, it shows that the majority of POTS is autoimmune. In fact, that's a study out of that was from the American Heart Association, Journal of the American Heart Association. But there's an autoimmune component often. Now, the autoimmunity is against beta adrenergic receptors, so they're adrenaline receptors, norepinephrine, epinephrine receptors, and so when you get autoimmunity against those receptors, then you get these adrenaline dumps and adrenaline spikes and things like that. But those beta adrenergic receptor antibodies and things like that, they're not really commercially available. They're not readily available for me to test. I don't know that LabCorp or Quest offers them, or if they do, I'm sure they're exorbitantly expensive, but they're not commonly run in a commercial setting. But there is often an autoimmune component. And I just think that that's really important to know that when you have POTS, sometimes your goal is just calm down the autoimmune response, whether that be through diet or be through supporting tolerance mechanisms or just calming down the autoimmune and antibody production and autoimmune just kind of mechanism. Mast cells are often involved, so there's often a histamine component. There's often a mast cell component. There's literature, supporting this. And mast cells line the autonomic areas of the brain, like the amygdala. Mast cells increase blood-brain barrier permeability, which permits focal inflammation of autonomic regions of the brain and things like that. But mast cells and histamine are just often involved. And there's often also like decreased cerebral blood flow volume. So you want blood flow to the brain. So these patients might also have like Raynaud's or different other blood flow issues or cardiovascular issues, but they'll also have symptoms like brain fog, poor brain endurance and fatigue, or the dysautonomia is just, again, associated with decreased blood flow volume. So things like concussions. And then mold and mycotoxins, because mold and mycotoxins and other chemicals are chemical concussions. They can cause neuroinflammation that's associated with decreased cerebral blood flow volume and some of these neuroinflammatory changes. I've heard it said, this is before maybe the long COVID era, but I've heard it said that mold and mycotoxins are involved in 100% of POTS cases. I don't know that that's like literature confirmed. This is an anecdote from some clinician who treats POTS and who sees a lot of POTS, but I don't think that that's an unfair assumption that mold and mycotoxins are often involved in POTS. And nowadays, long COVID is often involved, and mold and mycotoxins are often involved in long COVID. But there's this, myriad of factors that combine to drive an autoimmune response, to drive a neuroinflammatory response, to drive a neurologic response that's causing all these, cardio and other responses, downstream of that. So that's just a little bit about POTS. If you've ever been diagnosed with POTS, you kind of know, but your case is probably a little different than the next person with POTS than the next person, but they're all similar as well. So here's the 5 products. First one is called Nitric Balance from Apex Energetics. I thought about putting in the pictures into the slide deck, but I just said I'll just grab the supplements and make a quick, easy slide deck. So Nitric Balance from Apex Energetics, a very interesting product, but the purpose of this product is to support nitric oxide. And there are 3 isomers of nitric oxide. One is called nNOS, neuronal nitric oxide synthase. It's really good. We want that. The other is called eNOS, endothelial nitric oxide synthase. It's also really good. It's good for blood flow and dilating blood vessels and getting good blood flow. We want that one. The third one is called iNOS, which is cytokine inducible, and it can lead to tissue damaging autoimmune process. It can lead to a self-perpetuating oxidative stress loop. It's a component of COVID, and it's interesting. It's also sort of associated, and it is associated with something called the no-ono cycle. So the no-ono cycle is mostly popularized by someone called Dr. Martin Pall. He's a PhD researcher. He talks about the no-ono cycle in things like chronic fatigue, in things like EMF sensitivity, and just some interesting things and mechanisms of how, like, pesticides and solvents and things like that kind of affect GABA receptors, affect acetylcholine. But anyway, these ingredients of this supplement are designed for those 3 isomers of nitric oxide and increasing blood flow. The other thing too about this product, it's designed for blood flow, but if you look at the current literature on nutraceuticals that are good for Alzheimer's and for neuronal activity, you're going to be like, I'm going to take nitric balance every day for the rest of my life. Because things like huperzine and vinpocetine alpha GPC have great research for just neuronal function too. But this is a great product that can really turn on blood flow to the brain and really increase blood flow to the brain in the shorter term, like pretty quickly effective. The next one is more in the longer term. So it's called Brain Reset by Pure Encapsulations. And the first product, is formulated by my mentor, Dr. Karazian, Dr. Tatis Karazian formulates this one. The next one is formulated by one of my other mentors, Dr. Sam Yannick. And the goal of this one is to basically support, it even says, promotes concentration, mental clarity, and memory associated with brain fog. And it's often associated with histamine-driven brain fog, but it's more for the neuronal side of things. But it has things in it like lion's mane. Lion's mane is a mushroom that can increase BDNF, brain-derived neurotrophic factors. Then things like bacopa, butcher's broom, feverfew, ginkgo, which are all things to increase blood flow and improve neuronal function and blood flow. But kind of poor miracle grow on the brain is how I've heard BDNF described. And then luteolin is an excellent anti-inflammatory mast cell stabilizer, so and great for the brain particularly. And there's also some riboflavin in this vitamin B2 as well. So the two of those are really more for blood flow to the brain and increasing blood flow in the short term and in the long term, and different ingredients in each. So I like that combo of products. The next one is TrueAdapt. This is an adrenal support, basically. It's a stress supporting product, stress recovery formula. It says, but here's why I like it. One has adaptogens, which adaptogens, the mechanism of adaptogens and how they impact things like cortisol and the stress response is they work on the brain. They work on the hypothalamus and the pituitary, which are all part of the autonomic nervous system. So it can just adaptogens can bring balance to dysautonomia. There's also adrenal glandulars, and a lot of people with these issues, I don't know if it's because of the POTS or if it's vice versa or whatever it is, but sometimes they have high cortisol, sometimes they have low cortisol, but there's an adrenal component, and they're often wired and tired, meaning sometimes their brain's easily wired and triggered and it won't shut off, and they're also tired and fatigued, and that doesn't always run with POTS. Those could be two different things, but there's often an adrenal component. But probably the reason that I like it the most is the licorice root, and licorice extends the half-life of cortisol, and cortisol, is anti-inflammatory. Cortisol helps support blood sugar and things like that too. So cortisol mostly gets a bad rap, but I think also has, a lot of healing benefits, and, it's very anti-inflammatory. But the main purpose of licorice root is licorice also keeps blood pressure elevated. So if you have high blood pressure, licorice is probably contraindicated or is contraindicated if you're on a high blood pressure medication. But licorice can be very, very, very beneficial in a POTS patient to keep that blood pressure elevated, to keep that blood flow going to the distal extremities and distal areas of the brain. So TrueAdapt Plus, out of all the adrenal products that are out there, that's my favorite one, and especially for these cases. The next one is called CRLA, and it's vitamin C. But vitamin C is great. Vitamin C is a mast cell stabilizer. I think everybody knows something about vitamin C, but this is vitamin C as sodium ascorbate, which I tend to see work better than ascorbic acid. And part of that is the sodium that helps keep blood pressure elevated, helps keep blood volume elevated. So sodium ascorbate, getting antioxidant support from vitamin C and from from R-lipoic acid. R-lipoic acid is particularly useful in POTS patients, or alpha-lipoic acid also, but it's particularly beneficial in POTS patients, and I've again learned that from some mentors of mine, but I use this particularly, I want to reach for it in POTS or dysautonomia or low blood pressure people. And then, is there two more or one more? This is the last one. So then the last one is Optimal Electrolyte, which is from Seeking Health. So that is, use different electrolytes, and a lot of POTS patients come in and they're taking like liquid IV or they're taking LMNT, and I don't know about liquid IV, but I know LMNT is clean. I think most electrolytes are actually quite similar. But the reason I like this one, first off, it's delicious. So I like taking it. My kids like it and stuff. But it has things like electrolytes. But then it has 3 different kinds of magnesium, it has sodium, but it has a high amount of potassium. It has 510 milligrams of potassium. And that's what you want to look for in an electrolyte is a high amount of potassium. But then it also has things for mitochondrial health. It has creatine, has a little bit of creatine, has taurine. Taurine is also good for bile flow and things like that. And it has ribose. Ribose is good for the mitochondria. So just some other things in this optimal electrolyte. But I've found that to be kind of a great, these two might be kind of in the morning, almost as like an adrenal cocktail type support. And this one as well. These are more on like the adrenal side of things. And these two are more on like the cerebral brain blood flow side of things. But a combo of those things. Now that's not the end all be all. There's a lot of other involvement. Mast cells and histamine didn't get mentioned. Mold and mycotoxins, glutathione, gut health. All the other things that go into fish oil just for general brain health. All the other things that just go into a healthy person. Vitamin D. The low hanging fruit things. But in POTS, if you are seeking further answers and kind of getting nowhere, or if you just have symptoms of dysautonomia, then these are 5 great things that you could give a try to, and 5 things that I've found value from, and my clients have found value from too. So let me know if you like that. Give us a like, give us a review, check out my podcast, check us out on Instagram, and subscribe to our YouTube channel too. I don't do videos that often, but I always have aspirations of doing more and more and more. But yeah, hope you enjoyed it.